You're watching Rogers TV, Barrie.
Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with a COVID-19 update for Simcoe Muskoka. To date, we have a total of 14,776 cases. This is up 366 cases over a week. And if we look at the week of November the 7th to the 13th, that week we had 331 cases, which is up 33% from the previous week at 249 cases. So for the past more than a month, we've had ongoing increases in cases, and then we had a near doubling of cases from 127 cases the week of October the 24th up to 249 cases the week of October the 21st, and then a further 33% increase to last week at 332 cases. So most definitely a sharp rise in cases in Simcoe Muskoka. We have at this point 428 active cases. This is up from 349 cases last week. And we have had a total of 275 deaths. So this is an additional 7 deaths since I last reported a week ago. And I would like to express my condolences to the family members for your loss. We note that we've had an increase in mortality in November compared with September and October. So in both September and October, we had 5 people pass away in each of those months. And so far in November, we've had a total of 9 people pass away. So definitely a marked increase in mortality as well in November. Of the 7 people that have passed away in the last week, 4 were fully immunized. And they are as follows: a man between the age of 65 and 79 from Simcoe County, a man between the ages of 45 and 64 from Simcoe County, a woman between the ages of 65 and 74 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man over 80 years of age, and a man between the ages of 65 and 79 from Simcoe County. The man over 80 years of age that I just cited was from Muskoka. One thing I would say about people passing away who've been fully immunized, they are representing a significant proportion of those who passed away recently. And this is something I've commented on before and has been seen across the province, and was also noted in data in the United Kingdom. The overall finding, first off, is that immunization is very, very important and very protective, and all the more so for older people over 70 years of age, over 80 years of age, that older people are at a much higher risk of dying if they contract COVID-19 and also respond well to the vaccine. So the vaccine is very important to protect them from contracting COVID-19, having a severe case and dying from it. And the great majority of our older population is fully immunized, over 95%. And so with that degree of coverage, we are going to see some breakthrough cases. The vaccine is highly protective, but not completely protective. There is a potential for breakthrough cases. And when they occur in older people, those people very sadly can go on and have severe disease and die from it. Hence, we are seeing some breakthrough cases resulting in death in older people primarily, who, in these instances, some of them had been fully immunized. that they in fact are breakthrough cases. But the bottom line is it's very, very important for people to get immunized. It's still highly protective. The likelihood of contracting COVID-19 and having a severe outcome is greatly diminished for people who receive the vaccine, for people who become fully immunized. At this point in time, we have 19 people living in Simcoe Muskoka who are hospitalized with COVID-19. This is down from 20 a week ago. And we have 5 in the intensive care unit, up from 4 a week ago. So their ages range from in their 20s to their 80s. 17 of them are from Simcoe County and 2 are from Muskoka. 5 are community acquired, 6 close contacts of a case, 6 part of institutional outbreaks, 1 under investigation, 1 part of a congregate setting outbreak. And when we look at their vaccination profile, 13 are unimmunized, 4 fully immunized, and 2 partially immunized. In the past day, the past 24 hours, we've had 76 cases. So that's a very large number of cases in a single day for us. 63 of them were sporadic cases, 8 were from school outbreaks, 2, I beg your pardon, 4 were outbreaks in congregate settings, and 1 community setting outbreak out of jurisdiction, so acquired outside of Simcoe Muskoka, but a person living here. 36 of them are men and 40 are women. Their ages range from under 10 to in their 80s, and 26% of them are under the age of 12. In other words, and we look at that age group because that age group is not yet eligible to receive immunization. 67 of them are from Simcoe County and 9 from Muskoka. In terms of acquisition, 39 are under investigation, 16 are close contacts of a case, 8 are community acquired, 8 are part of educational facility outbreaks, 4 part of congregate setting outbreaks, 1 part of a community setting outbreak. 73 of them are self-isolating at home, 1 is hospitalized, and 2 have recovered. In terms of immunization status, 27 are unimmunized, 2 are partially immunized, 27 are fully vaccinated, and 20 are too young to be immunized. Most of our active cases right now are residing in Barrie, Bradford, West Gwillimbury, Innisfil, and New Tecumseth. During the week of November the 7th, Barrie had the highest weekly incidence of cases at 107 cases per 100,000 population. And this would really take us back to wave 3 for them to have an elevated incidence of about 100 cases per 100,000 population. And this is up from 82 cases per 100,000 population last week. Springwater had 84 cases per 100,000 population, Penetangmashine 83 cases per 100,000 population per week, Wasaga Beach 68 cases per 100,000 population per week, and Innisfil 51 cases per 100,000 population per week. And Barrie's incidence has been increasing over the past 5 weeks. And back on October the 10th, they had an incidence of 25 cases per 100,000 population per week. Overall, Simcoe Muskoka's incidence is 55 cases per 100,000 population per week, starting the week of November the 7th. And this is up from 41 cases per 100,000 population the previous week. And the province's incidence is 27 cases per 100,000 population, up from 22 the previous week. So at this point in time, we are about double the incidence of the province. This is the 4th week in a row in which Simcoe Muskoka has had a rate that's been higher than the provincial incidence. During the week of November the 7th, 23% of our cases were under the age of 12, so not able to be immunized. And the majority of these were school age, between the ages of 4 and 11. The weekly incidence of cases is highest among children under the age of 12, but second highest among youth, 12 to 17 years of age. We presently have 23 outbreaks, up from 17 last week. They're as follows. A child care center in Simcoe County that was declared on the 8th of November. Another child care center in Simcoe County declared on the 4th of November. In terms of schools, we have a number of primary schools. They predominate with regards to locations of outbreaks in Simcoe, Muskoka, and for that matter, across the province. They are as follows: St. Marie of the Incarnation, commencing or declared on the 15th of November. Emma King Public School, declared on the 17th of November. Nottawasaga Elementary School, declared on the 12th of November. VK Greer, declared on the 9th of November. St. Catherine of Siena, declared on the 1st of November. W.C. Little Elementary School, declared on the 12th of November. Terry Fox Elementary School, declared on the 10th of November. Monsignor Clare Elementary School, declared on the 15th of November. EEC Samuel de Champlain, declared on the 3rd of November. St. Bernadette Elementary School, declared on the 9th of November. Maple Grove Public School, declared on the 16th of November. We have one fitness and recreational center outbreak in Simcoe County, declared on the 2nd of November. RVH in outbreak since the 29th of October. The Pines Long-Term Care Facility declared as an outbreak on the 30th of October. We have a congregate setting in Muskoka declared as an outbreak on the 16th of November. An overnight camp in Simcoe County declared as an outbreak on the 10th of November. A private school declared on the 8th of November. Religious organization in Barrie declared on the 4th of November. A secondary school, St. Peter's Secondary School, declared on the 8th of November. We have a couple of shelters that have been declared, and they've actually put out a press release about themselves. I'll leave it for the media to note their press release, I should say, both located in Simcoe County. And one declared on the 1st of November, the other one on the 8th of November. In terms of immunizations, we continue pursuing the last mile. And this is, of course, the most difficult stage of the vaccination campaign for first and second doses. So at this point, 87% of those 12 and above have received their first dose, and 84% have received their second dose. And we note the need to elevate immunization, particularly among young men, 18 to 29 years of age. And so far, 14,528 residents in Simcoe, Muskoka have received a third dose of vaccine. From our data, we know that the incidence, likelihood of getting COVID-19 for those who are unimmunized is 8 times higher, and the likelihood of becoming hospitalized 11 times higher than for those who are fully vaccinated. So this is Simcoe, Muskoka data from September the 19th to November the 13th. And we also note during the week of November the 7th that 30% of our new COVID cases are among those fully vaccinated. If we look at our dashboard, we are now in red status due to increased viral spread. Incidence of cases, our reproduction numbers at 1.1. Anything above 1 means spread of the pandemic. Laboratory testing is in yellow status, and this is because our percent positivity is up to 3.3%. Anything above 3% is of concern. Otherwise, lab turnaround time for test results is on target. Health system capacity is in green at this time in terms of bed availability, and public health system capacity is in red. We do have some reduction in our response time. With cases, we're down to 62.7% of our cases being reached within 1 day. Our target for that is 90%. Okay. All right, some key messages as follows. We continue to see an increase in our cases, and we note that this is part of something that's happening elsewhere in the province. The province as a whole has had some increase, and there are certain other health units that have large increases in cases. Some located in southwestern Ontario, in the east, in the Kingston area. Ourselves, Simcoe, Muskoka, are twice as high as the incidence that we're seeing in the Greater Toronto area. And then in the north, Sudbury at over 100 cases per 100,000 population. Algoma also having a very steep rise in cases. So far, the province is positioning that they are staying with their overall content within the Reopening Ontario Act and maintenance of the measures that are in place, not proceeding with, at this time, lifting capacity limits in other venues, which is certainly something that we support in public health. And some health units are putting in place certain additional control measures or already have done so. And I will be touching on additional measures that we will be putting in place shortly in a moment. But just to provide a little bit more positioning on this topic, when we look at the overall picture, we see that we've had the greatest number of outbreaks in elementary schools. And this would be a pattern that's been seen across the province and reflective of the fifth wave being driven by cases that are among those who aren't immunized or only partially immunized. We are seeing some breakthrough cases, but most of the cases are among those not immunized or partially immunized. And that certainly includes those who can't be because of their age, that they aren't eligible yet to be immunized. And so many more outbreaks in elementary schools than in secondary schools or in other settings. In Simcoe, Muskoka right now, we have 12 elementary schools, 2 child care centers, and a recreation sporting organization that are in outbreak. We do note certain other locations as well of concern: a hospital, 2 shelters, 1 long-term care facility that are in outbreak, 2 secondary schools, 1 place of worship, and a congregate setting and a recreational camp that are in outbreak. So the clustering in schools and in child care centers is of note, but we are seeing evidence of transmission elsewhere in the community beyond just young children alone. We do note that a higher percentage of our cases are occurring among those under 12 years of age, those who can't be immunized. So 26% of our cases in October, as opposed to 15% of our cases in July. We have limited capacity to follow up on cases in depth with regards to potential discovery of outbreaks. And so we note that there are certain other locations that we haven't been able to declare as outbreaks. but still are showing clustering and the potential for outbreaks, the potential for transmission. So these have been noted in some food premises, a recreational facility, 2 hotels, motels, or short-term rental locations, 13 multi-unit dwellings or private residences, 6 places of worship, and 12 workplaces. So I think it's really important for people to take note that not only are we seeing a rise in our cases and a rise in the number of outbreaks, but we're also seeing a range of other locations where there have been exposures and potential outbreaks. Okay. We also note third dose vaccination availability at our clinics, and the province has noted that there's been a limited uptake so far for boostering, and that there's certainly more room or capacity for people who are eligible to receive their booster vaccine to do so. And there's also the provision of third dose vaccination for those who are immunocompromised. And this can be given 2 months after their second dose. So boostering is at 6 months, but for those who are immunocompromised, we're now considering a third dose to be part of their primary series to be given 2 months after their second dose. And they consist of a very specific group of people. So those who are transplant recipients, those with solid tumor or blood cancers, hematological cancers on active treatment, those who are severe, who have severe primary immunodeficiency conditions or advanced untreated HIV, and those who are on specific immunocompromising medications, the list of which can be obtained online on our website or on the Ministry of Health website. So certainly we advise people to come forward who fall into those categories to receive a third dose, and they generally can do so through their healthcare provider, the hospitals. Our clinics are able to do this, as is RVH's clinic at 29th Sperling. We have noted that some people have come forward to receive this vaccine and they don't actually, this third dose, and don't actually meet these criteria. They've identified themselves as being immunocompromised, but they don't actually meet the definition as I've just described. And in those instances, we won't be able to provide a third dose vaccine to them at this time. Certainly, there are others who are eligible to receive a booster dose at 6 months post second dose, and these include those who work in a healthcare environment, healthcare providers, those who are 70 plus, certainly those who are adults living in long-term care facilities or retirement homes, and other congregate settings, essential care providers in congregate settings, and individuals who received AstraZeneca 2-dose primary series or Janssen 1 dose would be eligible to receive an mRNA third dose booster at this time. And we are taking walk-ins, continue to offer some walk-in hours, which are listed on our website for this. We have a new resource on our website now for businesses and organizations that are experiencing an increase in COVID-19 cases. And so I'd already listed the kinds of locations in which we're seeing exposures in work environments. And so to help organizations, businesses deal with that, we do have a resource for them on our website that identifies how they can increase their control measures to make the workplace safer, and identify staff who would need to be isolated and because of their symptomatology, and some communication tools, including letters that they can lift and put their letterhead on for communication with their staff. So I just want to draw the attention of business providers to that resource. We have the holiday season coming on, of course, and we have some advice on our website for people to reduce their risk. And we are noting specifically a difference between those who are immunized and those who are not. So for those who are not fully immunized, they are at greater risk. It would be safest for them to remain with household members until they're fully immunized. And if they aren't abiding by that, to maintain masking and physical distancing from others, and keep themselves to a very limited number of contacts. For those who are fully vaccinated, we do advise that they also reduce their contacts beyond their household members and stick with a consistent group of the same individuals as contacts to reduce the potential for transmission. And always when indoors for all individuals, it'd be preferable that your contact would be with people who are fully vaccinated. Beyond household members, maintaining physical distancing and wearing face covering or mask would be the safest thing to do. And this is advice that I'm speaking to. We also have our letters of instruction on our website that would specify what's really required in public settings, indoor public settings, and workplace settings to help reduce the risk of transmission. So we are seeing an elevation in our cases. We are twice the incidence of cases per 100,000 population over the week compared with the province. And the Premier certainly had noted that local medical officers of health can take local action as needed to address situations such as ours. We are going to be updating 2 letters of instruction with additional content. So one is I'd really directed at workplaces, about workplace safety and public venue safety. That's been a long-standing letter of instruction, and it is being modified to make it clear that it also applies to places of worship, and that there would be the requirement for the screening and for symptomatology, active screening, and exclusion of individuals who have symptoms, logging contact information for the attendants, maintaining conditions so that physical distancing can be maintained on the premises, and enforcing the use of masks for attendance for services. So this is certainly in place already for many other businesses and workplace settings, and now explicitly includes places of worship, or will shortly once I've released this, which will be in the very near future. Another letter of instruction that we have does require at this time, proof of vaccination for coaches and instructors working with youth and children, to ensure that such individuals, the instructors and coaches, are immunized, have proof of vaccination. So we're going to update that so that now it also includes a requirement for youth 12 and above engaging in indoor sporting activities outside of the school setting in other locations to provide proof of immunization. And we will choose dates within that letter to allow for individuals to obtain immunization. We will also be issuing shortly a revised order under the Health Protection and Promotion Act, Section 22 order. There is one in place already that requires cases and contacts to be isolated. But now we are extending that to include those under the age of 19 who are household contacts of an unvaccinated contact of a case, that such individuals who themselves are unimmunized would be required to be in quarantine for a 10-day period. And this is intended to help us reduce further spread in schools. We have a large number of primary school outbreaks, and this is meant to assist with reducing the numbers of these outbreaks and the size of these outbreaks. So all in all, we've got, in response to the present situation, coming shortly 2 letters of instruction and 1 order under the Health Protection Promotion Act. Also, we have on our website advice for businesses about managing cases among their employees in the work environment. And we have advice for the community about reducing risk for social events and gatherings during the holiday season. And we will continue to monitor the impact of these on transmission to determine whether additional measures would be required. We would also like to put out a call for volunteers to assist in our vaccination clinics. So certainly volunteers figured very prominently in our mass immunization clinics in the spring and summer. At one point, we had 500 volunteers assisting with those clinics. And now that we are commencing again another round of immunization clinics for the immunization of children 5 to 11 and for the provision of booster shots, as well as for first and second doses for people, the last mile, we will need more volunteers again. I really want to emphasize just how grateful we are for the people that have been helping us out in this way for the vaccination campaign. We will need individuals to help us in our clinics in Collingwood, Wasaga Beach, Stayner, Greaterhurst, Barrie, Bradford, West Gwillimbury, and Alliston. They'll be needed in non-clinical roles, such as monitoring waiting areas, assisting and directing clients, and disinfecting and cleaning surfaces at the clinics. Specifically, we would need individuals who can stand for a long period of time, be 18 years of age or older, working indoors and outdoors, wearing personal protective equipment, and would have to obtain a satisfactory criminal record check and submit proof of COVID vaccination. I would ask that people go to our website in order to identify how to submit your application to be a volunteer. And once again, thank you so much for this. So I have a couple of questions pre-submitted by the media as follows. What's happening with the outbreak at the Simcoe County shelters? What are the current numbers? And is the outbreak at 2 shelters? What are the plans to keep things in check once winter arrives and people are in close quarters? Have the shelters been transitioned back into their regular models at this time? During COVID, they were transitioned into a COVID emergency shelter model where the county paid, and they were all moved into hotels based on health unit advice. Is that over now? And if so, what advice is the company giving them to try to avoid additional cases and outbreaks at the shelter? And if the shelters had been moved back into their regular spaces, did that likely contribute to spread? So that, this is a very, I think, in-depth and extensive set of questions. And I think I would like actually to develop a written fulsome response to those questions and put that out after the interview. Question from our Health Connection line. We note from our staff, we're getting a lot of questions about what our local plan is for dealing with the rising case numbers, and clients are referred to Dr. Moore's comment about referring to Dr. Moore's comment about local plan being implemented to deal with rising numbers, and wondering if I could speak about this at my briefing. And I would say that through my briefing to the press, I've indicated the approach that we're taking so far with our 2 letters of instruction, our order under the Health Protection and Promotion Act, our advisory document for businesses about managing cases among their employees, and our advice on our website about social gatherings and how people can reduce their risk. And we'll continue to otherwise monitor and see if further measures are taken. So at this time, I'd be happy to take questions.
Thank you so much, Dr. Gardner, for your update this afternoon. We will now take some questions from the media. As always, we do ask that you limit yourself to 1 question and 1 follow-up in consideration of time. Can we start with Erica Engel from Collingwood today? Do you have a question?
Do you mind just coming back to me later?
Sure, no problem. Can we go with Mary Beth Hartle from Muskoka Region? Do you have a question today? Okay, Mary Beth, maybe I'll come back to you.
Yeah, if you don't mind, sorry. I was just in the middle of another phone call, so I apologize. If you don't mind swiveling back to me, that'd be awesome.
No problem.
Thanks.
Can we go with Sean Gibson from Barrie Today? Do you have a question? Okay. And we'll go with Shane McDonald from simco.com. Do you have a question?
Sure. Hi, Dr. Gardner. I am wondering if you are noticing any trends or any observations to explain why the city of Barrie is such a significant source of all the latest cases. You noted that they're one of the higher ones. So I'm just curious, what are you seeing? Is there anything specifically, or is it just because of the denser population? So.
It's a very good question, and I don't have a definitive answer for it. Is where we're seeing, some of the outbreaks and school-based outbreaks, where I don't have a definitive answer for it. Through the pandemic, we've seen Barrie be very much one of the locations that's been hardest hit. But at this point in time, it happens to be the highest hit. And beyond the fact that that's where we're seeing some of the clusterings and some of the outbreaks, I don't have actually a definitive answer.
That's okay. I guess another question I had, you noted that one of your letters of instructions will be adding places of worship, for those contact tracing, all those other stipulations. And there was a story recently about the Mapleview Community Church and an outbreak there. I'm curious if the health unit is going to levy any fines against the church for that resulting outbreak, or if any other action is being taken in that case.
So at this point in time, we are investigating with them their outbreak and requiring action to bring it under control, and they are cooperative with regards to those actions. We take a progressive approach to enforcement and use education and seek cooperation in order to deal with situations. So at this point in time, we're not anticipating actually issuing a fine to them. And also we are issuing our letter of instruction to make it clear to the faith services what is required to reduce the risk of transmission in their premises.
Great. Thank you so much.
Nikki Cole from Barrie Today, do you have a question? Okay. James Bowler from Cogeco, do you have a question today? Okay. Can we circle back to Erica Engel from Collingwood Today? Do you have a question?
Thank you. Dr. Gardner, could you please go over the note you made about quarantining or stay at home for people under 19 if someone in their household is a contact? Is that for like unvaccinated youth and vaccinated youth, or?
Okay, good question. This is meant to be those that are under 19 years of age who are unvaccinated themselves and in their household have a person who is unvaccinated and is a contact of a case. So in a sense, this order includes contacts of contacts, so to speak. So you have a contact who's unvaccinated in a household, their household members who are under 19 years of age who are unvaccinated also need to go into quarantine.
Okay. And one of the things that you have said a few times is that you should try and if you're gathering indoors without a mask, make sure they're all vaccinated people. Is a vaccinated person more at risk by being around an unvaccinated person versus another vaccinated person?
I believe that they are. A person that is vaccinated is considerably less likely to become a case, to be a breakthrough case compared with an unvaccinated person. 10-fold more likelihood of becoming a case if you're not vaccinated. And even if you are vaccinated, by being exposed to somebody who's a case, you have an increased likelihood of becoming a breakthrough case yourself than if you didn't have that exposure. So one of the ways of reducing your risk is by maintaining close contacts, a circle of close contacts with others who are vaccinated.
Okay, and one quick follow-up. Are the community vaccination clinics open now or soon?
Mm-hmm.
Okay.
They're open as of the 15th.
Great, thanks.
And listed on our website.
Are there any questions from the phone line this afternoon? Okay. And Mary Beth Hardall, can I circle back to you? Do you have a question?
Certainly may. Sorry about that. I did tell them they had horrible timing. I wanted to get your response on the number of outbreaks in schools. And do we have, I don't think we have a definitive time as to when we're getting the vaccinations for the kids, but do you have an approximate time where we might be able to see that?
So I believe that we will commence immunization within November, by all indications, everything that I have heard. And certainly we're prepared for that. We have our clinics running now, so we would just give focus to those that are 5 to 11 years of age. Mm-hmm. Sorry, could you repeat again your first question?
We're obviously seeing an extraordinary number of cases in schools. How concerned are you about that?
Well, I am very concerned. It really speaks to the vulnerability of those who aren't immunized. And right now, the greatest number of those are among children. It speaks to the importance of us being able to commence immunization and for parents to come forward and have your children vaccinated once eligible to do so. It's a pattern that we are seeing across the province. So by no means are we alone in seeing this. And it also speaks to the importance of doing everything else that we can to safeguard our schools. So parents screening your children for symptoms and not letting them go to school if they have symptoms and seeking testing is important. And also the abiding by the order that we'll be releasing shortly for unvaccinated child, people below the age of 19, contacts of an individual, a person in your house who is a contact of the case. Those people going into quarantine is our additional measure that we will be getting going to help with the situation. But overall, I am quite concerned about the school outbreaks.
Thank you so much.
You're welcome.
Is there anyone who hasn't had the opportunity to ask their question this afternoon?
Hi, sorry, James Bowler from your TV. I probably got asked and I was just on another call, but I would like to know if I could.
Sure, go ahead, James.
Thank you. And I don't know if this has been asked already, Dr. Gardner, so I apologize in advance. So I just wanted to talk about the rise in our area, specifically Muskoka is now seeing a spike again when we're over 30 active cases. And I'm just wondering, beyond the measures that you're putting in place now, are we going, if we head in this direction throughout this month and into December, are we going to start seeing more restrictions on things like events and other types of things like that?
Mm-hmm. Well, that's a very good question. And certainly we've seen at least 2 health units now that have put in place the capacity limits that have been lifted through the month of October. So Sudbury District Health Unit was the first to do this, and Algoma proceeding with it as well. Certainly that is a comprehensive set of restrictions. At this point in time, we're not considering that, but we do note that that has been done. They have much higher rates of transmission than we have, but if we continue to rise, additional measures, perhaps those measures we would have to consider.
And just as a quick follow-up, the Premier was asked yesterday about whether or not the province should act at this point because of these historic scenarios we see now of numbers going up, no restrictions being put in place until it's too late. Do you think the province is doing enough at this point, or should they be doing more in terms of trying to curb this this possible wave that we're going back into again?
Well, for one, I think it's very good that they did not proceed with further lifting of capacity limits on Monday, as their schedule originally had them set to do. So I think that's very good. They do speak in support of local action. And I found that the Office of the Chief Medical Officer of Health to be readily available for consultation. And as health units, we are sharing resources such as the letter of instruction from Sudbury to help us. The province is positioning that they will not go back in any way. And I can understand why they want to position that. If in fact we find that you get broad elevation and surges in cases happening throughout the province in many jurisdictions, I think that they would need to reconsider that.
Thank you very much.
You're welcome.
Are there any further questions this afternoon from the media panel? Okay. Well, I believe that brings us to the end of today's media briefing. Dr. Gardner, thank you so much for your update and time today. And thank you so much to those who participated. Our next media briefing will be Wednesday, November 24th. Thank you so much.
Goodbye, everybody.
Recording stopped.